Hello, I'm Malcolm Haslett. What's the difference between a psychologist and a psychiatrist? And when do we need them? Well, let's find out more together now on Our Time. And welcome to Our Time. A question I've often wondered is what is the difference between a psychologist and a psychiatrist? We're about to find that out. We're also going to find out a little about how the coronavirus is affecting people emotionally. Now, Dr. Ray Taylor is our very special guest. Dr. Ray Taylor, MBBS. And the MBBS stands for Bachelor of Medicine and Bachelor of Surgery. Also, he's a fellow of the Royal Australian and New Zealand College of Psychiatrists. And you've been training all your life, Ray. Welcome to Our Time.
Basically, yes.
Not necessarily for this program, though.
True.
Ray, it's can I call you Dr. Ray or just Ray?
Ray's
or
fine.
Mr. Taylor or Mr.
Ray
Taylor,
will do
sir.
fine.
Now that's interesting. I should start that way, I suppose, because I guess when most people come to see, what are you, a psychiatrist or a psychologist?
Yes, well, I'm a psychiatrist, yes.
And that means that you have
Medical degrees, because psychiatry basically is a medical specialty, like being an orthopaedic surgeon or a neurologist or a cardiologist.
I don't know that everybody would totally understand that. So how would somebody come to see someone like you? Would you go through a GP?
Yeah, the referral would come through a GP,
Right.
like it does to any medical specialist, yeah.
And this is because somebody can be mentally sick, literally.
Yes,
Is that the main sort of areas that you would cover?
probably. It varies a lot depending on the type of practice. Some of my colleagues might concentrate on being psychotherapists. Some of them will concentrate on treating obsessive compulsive disorders.
Right.
Some will, in the public system, you'll see more people with schizophrenia and major psychiatric disorders like that and bipolar disorder.
How do you interpret this? Is it just a series of events? Obviously, you're trained to understand, but what happens when you meet a patient?
Well, you do the preliminaries of making them feel comfortable, and then you start to take a history. Start by saying, well, what's the problem as you see it?
Right.
And listen and ask a few appropriate questions to elicit symptoms they may or may not have had or experienced in the past. You'll then take a look at their earlier history, get some idea of their childhood.
That would have come from a GP, probably, or?
Well, you'll get a summary from a GP, but my experience is that most GPs write very short referral letters.
Okay, because it's not something they can really help with at the time.
Yes. So you interview the patient. You also look at family history, see if anyone in their family has had similar symptoms or related phenomena.
Well, so your consultation time wouldn't be as short as it would be with the GP.
No,
obviously.
you're looking at, I think the standard initial consultation, they say 50 minutes. It's basically 50 minutes interviewing and 10 minutes to write your notes up.
Right. But what you just said, interviewing, is exactly right.
Mm.
So for somebody to specialise in this, you started off just in medicine.
Yes, you do the basic 5 or 6 year, depending which university you went to, Bachelor of Medicine and Bachelor of Surgery. Then you do your internship year where you work in a public hospital under supervision and do your basic medical skills. And during that time, you think about what you want to do after you finish those hours of slavery.
Because it is, isn't it? It's very much underpaid slavery.
Yes, well, I think in 1968, when I worked at the Royal Adelaide Hospital as an intern, well, I was actually earning about 57 cents an hour.
Because you worked more than the 40-hour week?
Yes, I was on a fixed salary of about $3,500 a year, and on a short roster, I'd only be working 80 hours a week.
Right.
Whereas there were times when I was on duty 130 hours a week. I'd come into work on a Friday morning at 9 and knock off at 5 on Monday. And
how did you stay awake? Drugs?
Well, you didn't stay
No.
awake. They did provide a bed. And I can remember at one stage when there was a bit of a grizzle going on with the medical superintendent at the Royal Adelaide about staffing and he said, "Oh, yes, but we provide a bed." And I couldn't resist. I said, "Yes." And I had a really good last night. We actually got to go to bed 6 times. One of the times the sheets hadn't settled when the phone rang off.
Yes, are those days still the same, or have they changed?
Well, our lot took the matter to the industrial court,
Right.
and we got a ban on rostering us on duty more than 84 hours a week. But that paid off for the next year, not for us.
Yes, that's often the case, though, isn't it?
Mm.
You'd think, though, that would be enough to send you into the crazy farm itself.
Well, it is too much.
Yeah. But was that necessary to give you the resilience,
Well,
you think?
that's what the administrators of the hospitals always said.
You can tell I'm an employer.
Yes. Personally, no, it doesn't convince me.
No, and it doesn't really convince me either, because if you're not sleeping, you're not functioning properly.
That's right.
Is there sort of a common complaint that people come to you with?
There's a wide variety of complaints. And again, it depends on what type of practice you're in, whether you're in the public system or the private. I spent a lot of my time in private practice, and I suppose depression in its various sorts was one of the most common reasons for
Well, we'll talk about that in a minute, because obviously people are concerned, and all the time we're hearing about depression being escalating. It's escalating because of coronavirus. But for you, even now, you still have to keep your skills up, so to speak.
Yes, I have to do a minimum of 50 hours a year of continuing professional development.
Right, but haven't you retired?
Well, I retired officially from full-time practice in 2008, and after I'd done a bit of travelling, about 2011, I was getting a bit bored, so I've since then been doing just occasional locum work in public hospitals around the country.
And does that sort of, it's the old thing of keeping your hand in, I suppose, but does that give you, pleasure is probably the wrong word, but is it a satisfaction of what you've learned to do?
Yes, well, it is, because it's even when you're working hard and you get a bit tired, you get a certain satisfaction from using your skills and maintaining your skills, and actually sometimes managing to change what's been going on in this place you've never been before and actually improve someone's health.
Yeah, that's interesting. Because I was just thinking, as you were saying that, how many people in your profession need people in your profession, because you're absorbing all this, in a way, negativity all the time. Does it take a toll, or can you turn
Well, it
off?
does, yes. There was in the days when I was training in psychiatry in the early 70s, there used to be this thing called trainee psychiatrist syndrome. And basically what happened is that in the first year, you learned all your weaknesses and all the things you couldn't handle. And so by the time you hit second year, there was a tendency to start to feel inadequate and feel as though you'd never really get on top of it.
Yes, I can see that.
And a few drop out at that point. But once you get past that, you start to have assimilated more, then you come out of that.
Yes.
Yeah.
Oh, I suppose that's the same for most professions, if it's something that really you have to use your mind for. Do you feel that, like at the end of the day, though, are you exhausted by sort of the sorrow that people are feeling? Is it?
Well, yes, especially early in your career.
Taking your work home with you, I
Yeah.
suppose.
Well, you do learn how to isolate it.
Yeah.
It's a self-protective thing.
But you can't also stop thinking, oh, could I suggest this, or could I suggest
those things pop into your head.
Yeah. So you can also prescribe if there are drugs that are relevant or necessary.
Yeah, if people need antidepressants or antipsychotics or tranquilizers of one sort or another, if it's appropriate.
It's amazing, though, isn't it, what goes on in our head?
Oh, yes.
Really, the body is just to carry the head around when you think about it.
Yeah. When I told the physician I was working for in the last term that I was thinking of doing psychiatry, he says, "What, aren't you going to do a proper membership of the College of Physicians?"
Oh.
And I couldn't resist saying, well, I think psychiatry is the least boring field of medicine because it's the most diverse.
Well, you can't find, it's not something you can pinpoint
It's not
with an
cut and
X-ray.
dry.
Yeah,
No.
exactly.
Yeah.
Exactly. Amazing. Well, we're going to be back in a tick with Dr. Ray just to talk about some of the things that are affecting all of us right now. In a moment, we'll see you again. We're talking with Dr. Ray Taylor. Ray, we've got a couple of photographs here of you. First of all, this little black and white one. When was that and what were you doing?
Well, that was actually taken early in 1968. I sat for the final exams in 67 and became registered as a medical practitioner.
So you're on the left there, aren't you?
Yes, that's me on the left. I'm the taller one.
Yes.
Yes, and the others are a couple of close friends of mine. A guy called Carl Lashchuk in the middle, who also became a psychiatrist. And on the other end, the guy with the unlikely name of Volodymyr Skibinetsky,
Oh, okay.
who I think flirted with becoming a neurologist, but in the end elected to become a general practitioner.
Okay, so is that going backwards? Because if you're a GP, you must have so many things to try and consider.
Yes, well, you do.
You've got a whole body, not just a
yes.
head.
The old joke used to be that a GP learns less and less about more and more until they know nothing about anything, whereas a specialist learns more and more about less and less until they know everything about nothing.
I'm glad you remembered all of that. A moment of the mind. And the other shot that we've got here with you looking sartorial and magnificent.
That's 50 years later at the University of Adelaide's Jubilee celebration for 1968 graduates.
Oh, how wonderful.
Giving me a certificate, Jubilee certificate.
Is that the Dean of the university?
Yeah.
Ah, brilliant. Well, you look the same as you look now.
Fairly similar, yes.
Yes.
Beard's a bit fuller there.
You're auditioning for Father Christmas.
Yes, people keep telling me I should play Father Christmas.
No, there's only one Father Christmas, and that's him. You should know that, being a psychiatrist. What are you?
Psychiatrist.
That one. Now, speaking of being in this position and what's happening in the world at the moment, there's so much around about mental health because of all this. Now, some people, I would imagine, would think, well, what's different about staying home? But obviously people are worried more about their careers, their futures, their children. I can understand being a teacher as well. I can understand children specifically like to be with each other, and we all grow by being with each other. Is that the thing that's causing this sort of mental anguish?
To some extent, yes.
The human condition?
Yes. People are different. Some of them are extroverted and need much more interaction and ongoing interaction with other people, whereas others who are more introverted perhaps are happy to sit down and read a book or watch television.
Or stay home.
Or stay home or go out and walk or whatever.
By themselves.
So, obviously when you're isolated, the people who most need the activity and the mixing are going to feel the absence of it.
So what would be a general advice for somebody in that position that's feeling that loss of people? Is there a simple thing that one can do, like pick up the phone or?
Well, I guess so. I think you can try and stay in contact with your friends, even if it's by Skype or phone or Zoom.
Well, I've had a lot of friends from Victoria ring during the recent total lockdown. And I guess a lot of people are saying, ring a friend and talk to people, blah, blah, blah. But I can also see the value of that. But what it's been brilliant in doing is actually bringing those people together again, because we probably wouldn't have talked even on the phone, even our mobiles that don't cost the earth to ring interstate or even overseas. We're doing it.
Yeah, I think that's true. We're rushing around less. We've got a little bit more time up our sleeve. We're thinking about things to do. In fact, for example, I got in touch with a colleague of mine I knew when I worked in Melbourne for a while.
There you go.
Recently, by email, but
yep.
Yeah.
But it is that catching up thing, I suppose. And normally you do it in a social situation, but this is not that type of situation. So is this the time in our lives and perhaps the evolution of humankind to find other ways to communicate, do you think?
I think, yes, to some extent. I suppose we've followed a trend. There's been an ongoing trend. First it was writing letters, and then it was telephone, and then it was video phones, Skype.
Well, now that that's available, we're all starting to use it, but it's been available for ages and we haven't been using it.
Because we've got on with the old habits, yes.
Yes. And actually, that's the thing, isn't it? It's the old habits. Is this the way that our brains are wired to sort of continue doing similar things to feel comfort?
I think that is probably true to some extent. People follow the patterns that they've trained themselves into. And
Is
it
this
takes
a-
a stimulus to overcome that.
Right, but is this also a problem for your profession this is why you have to keep re-educating because things change, new information, new learning leads us off in slightly different directions?
Yeah, things are changing, and even diagnostic categories are changing. I mean, in psychiatry, they're all a bit artificial anyway, the diagnostic categories, because quite often people don't quite fit the boxes that are published in
Yes.
things like the Diagnosis and Statistics Manual.
Right, well, I can imagine that because the social influences, possibly even the chemical influences that are going on in the world, and I'm just meaning the air that we breathe, must be affecting us in some way.
Well, they are to some extent. I mean, I'm prone to allergic rhinitis. And
Me too. Plane trees, they should all be banned. They should all be banned.
Yes.
Anyone who works for a council, please get rid of the plane trees.
yes, I
plant
don't get
gum
on
trees.
too well with plane trees either, actually. But one of my sensitivities is petrochemical.
Right, oh, okay.
So
What about smoke from, say, an open fire and some of the things that we've been having during winter time?
yes, well, that affects some people more than it affects others.
Do you find in social situations, if you're just standing chatting with a group of friends, you're sort of analysing them, or can you turn off from that?
I'm pretty good at turning off from that. Yeah.
Is that hard though? Because particularly if it's somebody you know and they might be talking to you about a problem, do you find that people, because they know what you are,
That's tended to happen.
how do you shut it down politely?
You slightly shift the subject, or you make a joke of it.
Yes.
I can remember going to a party once, and the hostess ran around introducing, saying, "This is Ray Taylor. Watch what you say as a psychiatrist." So I very quickly learned to say, "Don't worry, if nobody's paying, I'm not thinking."
Yes, fair enough. Because that's the reality, isn't it? As a professional person, it's difficult for others to not want to come to you. I have friends who are doctors and get 5 o'clock in the morning phone calls. It's like we have to have a life outside of our professional life.
We do.
So we've just quickly talked about simple ways of solving, like pick up the phone and ring somebody or communicate, or the Skype or all the other platforms that you can use. But if somebody is starting to feel like I'm not functioning properly, are there any signs that people can sort of recognise to say, I need some help now?
Well, there can be, yes, various ones. I mean,
Well, obviously everything is different depending on what...
sleep disturbance, changes in appetite.
Well, let's talk about
fatigue.
sleep disturbance. Is there any one thing that sort of causes that, or is it worrying too much?
It can be all sorts of things. It's hard to.
Without a person in front of you explaining the background story.
But some people have difficulty getting to sleep because they're still reviewing constantly what's on their mind. Other people seem to be able to put that aside and do it. Some people will then dream about it and wake up in the night because they've had a disturbing dream. Some people it doesn't happen to.
Yes.
And there seem to be that there are both psychological, trained into as factors, and there do appear to be some brain development factors that are genetically shaped, which can influence sensitivity to those areas.
Oh, I'm glad I don't have to make these decisions that you obviously would, because there is so much to know and so little time we have on earth to learn it.
Yes, it's always growing.
Yes. Did you enjoy this process? Did you feel that you were helping people?
Yes, I think, yeah.
Is that part of like a human condition too?
Well, I think it's part of anyone choosing to be a doctor, really.
Really, anybody choosing to walk on the planet. We should all be aware of helping each other, I guess. Did you feel that this was your calling as a child?
Actually, when I was 13, I wanted to be an astrophysicist.
Oh, Okay.
But I was also a smart enough kid to know that that era there were 3 good jobs in the world, and to know that I perhaps wasn't a diligent enough student to get a good looking enough degree to score one of those 3
To get to that
positions.
point.
So I started considering other options. I flirted with law, I flirted with architecture.
Are you glad you did what you did?
Yes.
And this career that you've had, has it been a fulfilling career, or has it actually caused more obstacles for you in life?
Oh, it's a mixed bag. I mean, it's in many ways very fulfilling, but it can also be draining and tiring. And
When does the psychologist go to a psychologist? When does the psychologist go to a psychiatrist?
yes, well, it's a question of what the relative need is.
Yes.
I mean, I've had dentists among my patients.
Oh, okay.
So they're not.
And they say that that's the one that's the profession that has the most trouble.
They have a relatively high suicide rate, yeah.
Could it be because their
Vets
patients
don't
aren't
do well,
asleep like the surgeons?
It might be
perhaps?
that, yeah. Vets seem to have a few problems with
Oh,
depression
really?
and suicide too.
What is it, the pressure or?
Well, I've read an article actually about it not that long ago. Apparently one of the problems for veterinarians is that people want them to fix their dog or their cat, but they don't want to pay it what it costs.
Oh, okay.
So they say if you really loved animals, you'd do it for free.
Right, yes. Well,
But,
we all have to eat.
Yes, that's right. So you do get among vets those who really get torn by that sort of pressure.
I can understand that, but without people like yourself and the knowledge that you've got, people who do have emotional and mental issues, where do you go? Without people like you, where do you go?
Well, I suppose the sensible thing to do is start with your GP.
Yep.
And get appropriate.
No, but I
advice
mean
where to
in
go.
life, if people like you didn't keep training their entire life to know, how to help people. So really, you're paying for a lifetime of experience, not just for that 50 minutes.
Yes.
Yeah. We'll talk more in a tick, but we have to take a short break and we'll be back in a moment. We're talking on this episode of Our Time to Dr. Ray Taylor. Ray, depression is a thing that many people suffer from. We've just talked about it with COVID-19, but there's more than one type of depression. Is that the...
Well, yes. When you look at things like the DSM classification of major depression, it lumps it based purely on symptoms. It doesn't necessarily base it on the causation of the symptoms. So some people, it will be a reaction to stress in their lives.
Right.
Some people, it will be a reaction to stress from their past in their lives that
Right.
they haven't resolved to. Some people, there is a form of depression that actually has a genetic basis and runs in families.
Right.
And of course, the fourth state is a mixture of those.
Right. Confusing to sort out in the first state.
Yeah. So the problem is then, and that's where family history is important. You have a look, if you get the clue that there's a high family incidence of depression, you start to wonder about the biochemical possibilities.
Right, because a condition could also be caused by a physical condition.
Yes, that can happen. There've been at least 3 occasions when I was referred patients for their alleged depression and discovered they had frontal lobe brain tumours, because I could order
Right.
an electroencephalogram from the local neurologist.
Right. Oh, gosh. When you're dealing with the brain, it just, it's got to be the ultimate thing in life, in actual fact, because everything is there for human beings, isn't it?
And one of the high spots of my career was being referred a medical student by a professor of medicine at one of the universities for his depression, and I proved he had toxoplasmosis.
You'll have to wait till after the program to work out
Which he
what that
caught
actually
from a
is.
cat. It's a
Really?
it's a microorganism bigger than a bacteria, like a small amoeba type thing, and cats commonly carry it.
How extraordinary. I'll never kiss the cat again. Not that I ever have, but
Not many people catch it from them, but I took great delight in writing back to the professor of medicine.
so much to learn and so little time. Ray, thank you so much for being our guest on this episode of Our Time. And we hope that this has helped you if you've got any issues please go and see your GP. And if you need to be referred on, they'll do that. So until next time we meet on Our Time, thanks for being with us. Keep yourself nice till then. We'll see you soon. Bye.